Hello dear students, I am Professor Dr. Dharmendra Sharma. I am the Principal and the Head of Department of the Department of Forensic Medicine and Toxicology at the D.Y. Patil Homeopathic Medical College in Pune. Our lecture is about ethical dilemmas and consent. As we all know, dilemma means that you are in two minds, whether you go for this or you go for that. So, in the medical field, ethical dilemmas involving the consent are among the most challenging issues of healthcare professionals, usually what we face in our lives. The consent is the cornerstone of the patient autonomy, ensuring that the individuals have the right to make informed decisions about their medical care. However, this principle can be tested in complex situations where what a patient wants may conflict with what the healthcare providers believe is in the best interest of the patient. For example, a competent adult might refuse a life-saving procedure due to his personal beliefs, fear or mistrust of the medical system, placing the healthcare provider in a position where respecting this choice could result in harm or even death of the patient. Moreover, consent becomes even more complicated when dealing with patients who may not have the full decision making capacity, such as minors, individuals with cognitive impairments or those in a state of unconsciousness. In these cases, the ethical principle of beneficence, which obligates the providers to act in the best interest of the patient, often collides with the need to respect patient autonomy. For instance, the parents may refuse or recommend treatment for their child based on some religious or cultural beliefs, challenging the doctor to balance the patient's authority with the child's right to appropriate medical care. Additionally, cultural and societal factors can further complicate the consent. In some cultures, the patients may defer the decision making to family members, believing that it is their family's responsibility to make such decisions. This can create an ethical tension for the healthcare providers and the doctors, who must navigate respecting the cultural practices while ensuring that the patient's individual rights are not compromised. In emergency situations, these dilemmas further intensify when a patient is unable to provide consent due to their condition and immediate action is also needed. Healthcare providers and doctors often operate under the principle of implied consent, assuming that the patient would agree in life-saving measures if they were able to consent. So, doctors always think that if the patient if he would have been okay, he would have definitely given his consent. So, implied consent, they work on the principle of implied consent. However, this assumption can be ethically problematic if the patient has previously expressed specific wishes, such as refusing certain intervention based on religious beliefs or any other belief. Resolving such dilemmas requires a multifaceted approach, often involving ethical decision making frameworks that help providers analyze the situation from various angles. Communication is crucial. Providers must ensure that the patients and their families are fully informed about all the risks, all the benefits and alternatives to the proposed treatment. When the conflicts arise, consultation with ethics committees, the legal advisors or cultural liaisons may be necessary to find a resolution that upholds the ethical standards while respecting the patient's values. Ultimately, ethical dilemmas involving consent require a delicate balance between respecting patient autonomy, ensuring beneficence, and adhering to the legal and professional standards. These situations demand not only clinical expertise, but also deep empathy, cultural sensitivity, and a commitment to the ethical principles, ensuring that the patient's dignity and the rights are preserved even in the most challenging medical scenarios. We will discuss few cases so that you get an idea about what actually we are talking about. So, we will take the first case, complex scenarios involving consent. The scenario is such: Dr. Patel, who is a cardiologist and is treating Mr. Thompson, these are just fictitious names, a 72-year-old man with a history of a severe heart disease. Mr. Thompson's condition has deteriorated now, and Dr. Patel recommends urgent surgical intervention is necessary. However, Mr. Thompson expresses his wish not to undergo the surgery, fearing the complications. So, his daughter, who holds his power of attorney, she insists on the surgery, who believes that it is the best option for her father to survive. Now, Mr. Thompson, remember, is mentally competent, but is also under significant stress, but he says that no, I want to cancel this, I do not want to go in for the surgery. So, now ethical dilemma is there for Dr. Patel. The dilemma is such: should Dr. Patel respect Mr. Thompson's autonomy and decision not to undergo surgery, or he should follow the daughter's wishes which align with the principle of beneficence, that it is good for the patient. So, what should the doctor do? So, he is in a dilemma now. So, in this scenario, the primary ethical principle is respecting the patient's autonomy. So, what Mr. Thompson says should be respected. Since Mr. Thompson is mentally competent, his decision should be respected even if it goes against the medical advice and the advices of his family. So, Dr. Patel should ensure that Mr. Thompson fully understands the risks and the benefits of this surgery and one which he is refusing, and document the discussion. He should also explore Mr. Thompson's fears and provide support to him. Possibly he could involve another counselor also, or the patient advocate, to facilitate the decision making process. So, he can even get a counselor to help Mr. Thompson understand the procedure and the importance of the surgery. Coming to another case, balancing the autonomy with beneficence. The scenario is such: a fictitious name, Mrs. Ria, and a 45-year-old woman with an early staged breast cancer has been advised by her oncologist, Dr. Green, to undergo chemotherapy followed by surgery. Mr. Ria, after conducting her own research, decides to refuse the chemotherapy and pursue alternative treatment. Dr. Ganesh is concerned that without chemotherapy the cancer will progress and worsen the condition or the prognosis of the patient. The ethical dilemma of Dr. Ganesh is how should he balance the principle of beneficence with Mrs. Ria's autonomy in deciding her treatment. So, the solution is Dr. Ganesh should engage in a thorough discussion with Mrs. Ria, respecting her right to make an informed decision about her health. He should also provide a clear evidence based information about the potential outcomes. He can show her cases, scenarios where people have refused chemotherapy and the condition has declined. So, he should also tell about the potential outcomes of both the conventional medicine and other traditional or alternative medicines available. If Mrs. Ria persists in her decision, Dr. Ganesh should respect her autonomy, but may recommend regular monitoring and to assess the benefit of the alternative treatment. He can also recommend regular monitoring and the alternative treatment which is suggested, the effect of that also must be checked regularly. Documenting this informed consent process is crucial in this case to avoid further ethical complications or legal issues. Coming to case number 3, informed consent in emergency situations. So, Mr. Zhang, who is a 60-year-old man, arrives at the emergency department. He is unconscious after a car accident. He requires immediate surgery to stop the internal bleeding. His wife, who is present, is in a state of shock and unable to provide clear consent. So, the patient nor his relative is able to give the consent. Mr. Zhang's medical records indicate that he has previously refused blood transfusions due to religious beliefs. So, he does not want blood transfusion. Now, the ethical dilemma is, should the surgical team which is available in the hospital with the blood transfusion, given the life threatening situation which is there, or respect Mr. Zhang's previously stated wishes? Should they give the transfusion or should they respect the patient autonomy? So, we have a solution for that. In the emergency situations like these, immediate action is required to save a life, and the patient is unable to provide the consent, neither the relative is able to do so. So, the principle of implied consent generally applies here. However, Mr. Zhang's documented refusal of blood transfusion also needs to be respected. The surgical team should proceed with the surgery while making every effort to honor Mr. Zhang's wishes, that is, alternative strategies such as bloodless surgery techniques. If you have a bloodless surgery, then you do not need to go in for a transfusion, should be employed if possible. The team should document the decision making process and involve the ethics committee if the time permits. The next case, number 4, is about ethical decision making in a pediatric consent. So, the scenario is such that Sarah, a 14-year-old girl, is suffering from disease called as cystic fibrosis. He is recommended for a new experimental treatment by her pediatrician for cystic fibrosis, Dr. Lee. So, Sarah is hesitant about the treatment due to its potential side effects which could happen, while her parents are eager for her to try this new experimental situation, hoping for improvement in her condition. When there is no hope available, you go in for whatever is available and best, even if it is an experimental procedure. Now, the ethical dilemma is such that Dr. Lee, how should she approach the situation where there is a conflict between the minor's autonomy and the parents' wishes? So, the solution could be that Dr. Lee should assess Sarah's ability to understand the treatment and its implications, because she is 14-year-old, recognizing that minors have a varying capacity for decision making. Involving Sarah in the discussion is very crucial to respect her emerging autonomy. She is young, so her emerging autonomy. Dr. Lee should mediate between Sarah and her parents, ensuring that Sarah's concerns are heard while providing her with support and information. So, help her make a good decision. The best interest of the patient should have the final decision, possibly involving an ethical consultation if needed. This is a very condition of dilemma. Coming to case number 5, consent and cultural sensitivity. Dr. Ahmed is treating Mrs. Bakshi, who is a 65-year-old woman from a culturally conservative background, for a chronic illness. When discussing the treatment options, Mr. Bakshi insists that her son should make the final decision, as she believes it is her family's duty to decide for her. However, her son is not available and the decision is very time sensitive. So, who will make the decision? The dilemma is, How should Dr. Ahmed proceed with the patient when the decision making has been delegated to the family member due to cultural beliefs, but the situation is such that the son is not available, but this thing requires an urgent decision. So, Dr. Ahmed should respect Mrs. Bakshi's cultural values while also ensuring timely medical care. It is a place where the doctor really needs to decide what to do. He should attempt to contact the son as quickly as possible and document the patient's wishes. If the son remains unreachable and the decision is urgent, Dr. Ahmed may need to proceed with the most beneficial option while ensuring that Mrs. Bakshi understands and agrees with this course of action. If time allows, consulting with an ethics committee or a cultural liaison can help address any cultural concerns appropriately. Coming to the next case, which is case number 6, interactive discussion on real world ethical dilemmas. The scenario as such: during a clinical ethics seminar, a group of medical students discuss a hypothetical case where a patient with terminal cancer refuses pain management due to fear of addiction, that I will get addicted to this pain management. So, a patient is refusing it, patient is suffering from terminal cancer. Now, the students are divided in two groups, with some arguing that the patient's autonomy needs to be respected, while others believe that the principle of beneficence should guide our decision. So, here everybody is in a dilemma. So, should the students reconcile the conflicting ethical principles of autonomy and beneficence in this case? How can they do this? So, there is a solution for this, that this scenario involves or provides an opportunity for an interactive discussion using ethical decision making frameworks such as the 4-box method or the principles approach. The students should consider the patient's values, the risks and benefits of the treatment, and the potential outcomes of respecting the patient's wishes versus intervening for their well-being. They need to decide between these two things. The goal is to reach a consensus that respects the patient's autonomy while also addressing their overall well-being, possibly through patient education or alternative pain management strategies. Coming to case number 7, refusal of treatment due to fear of side effects. So, this scenario is as such: Mr. Johnson, a 68-year-old diabetic patient, has been advised to undergo amputation to prevent the spread of the severe infection in his foot. However, he refuses the procedure, citing his fear of the physical and psychological trauma associated with amputation. His family members are urging the doctors to convince him, as they fear the infection will be fatal. There is an ethical dilemma here. Should the healthcare team respect Mr. Johnson's autonomy, even though his refusal of the surgery could lead to serious harm or death? The solution in this case: Mr. Johnson's autonomy should be respected, as he is mentally competent and fully capable of making informed decisions. The healthcare team should provide the detailed information about the consequences of his choice, that if he amputes, obviously there will be issues, but life will be saved, and involving psychological counseling if needed. Documenting the psychological counseling also needs to be done, and we need to also document the decision making process, which is crucial to ensure that Mr. Johnson is well aware of the risks of the decision he is making. So, this is a possible solution. Coming to case number 8, consent for a mentally ill patient. The scenario is as such: Mrs. Singh, a 52-year woman with schizophrenia, has been diagnosed with early stage kidney disease and requires treatment. However, due to her mental illness, she refuses the recommended treatment, believing it as a conspiracy against her. Her legal guardian insists on the treatment for her. Now, there is a dilemma here. How should healthcare providers proceed with a patient with mental illness who is refusing treatment, but the legal guardian is giving the consent to go ahead with the treatment? So, the solution, possible solution: healthcare providers must first assess Mrs. Singh's capacity to make informed consent or informed decisions. If she is deemed incapable due to her mental state, her legal guardian's decision should guide the treatment as the best interest. Now, she is already suffering from schizophrenia, so she is not mentally fit, but her relative or her guardian is mentally fit. The healthcare team should work with a psychiatrist to manage Mrs. Singh's condition and possibly engage in behavioral interventions to help her understand the need for treatment. This is another possible solution for this case. Coming to the next case 9, about maternal fetal conflict. The scenario as such: Mrs. Joshi is a 30-year-old pregnant woman, is diagnosed with a life-threatening condition which requires immediate intervention. The treatment poses a risk to her unborn child. Mrs. Joshi, valuing her child's life over her own, refuses the treatment despite the strong recommendation of her healthcare providers. The dilemma is, should the healthcare team prioritize Mrs. Joshi's autonomy in refusing the treatment, or should they prioritize the well-being of both the mother and the fetus? A possible solution: Mrs. Joshi's autonomy must be respected, even though it may lead to harmful consequences for both her and the fetus. The healthcare teams should ensure that she fully understands the risk and benefits and explore whether she may reconsider her decision based on additional information or support from loved ones. In complex maternal fetal conflicts, ethics consultation must also help to navigate such decisions. This is another possible solution for this. Coming to our next case, number 10, cultural conflict in the end of life care. Now, the scenario as such: Mr. XYZ, a 82-year-old man, is in the terminal stages of lung cancer. He expresses his desire to be kept comfortable and not to receive any life prolonging treatments. He has given it up. However, his family is not given it up. The family opposes this decision based on their cultural belief that all the life saving measures should be pursued till the very end. The doctors are in a dilemma now. How should the healthcare providers handle the conflict with Mr. XYZ's personal wishes versus his family's cultural values? Possible solution is, Mr. XYZ's autonomy and expressed wishes should be honored, and he is capable of making the informed decisions. The healthcare providers should engage the family in a compassionate discussion, explaining Mr. XYZ's wishes while addressing the family's cultural concerns. A palliative care team may be involved to support both the patient, Mr. XYZ, and the family, and ensuring that his comfort and dignity are preserved during the end of life care. Case number 11, consent and cognitive decline. The scenario is as such: Mr. ABC is an 85-year-old man with moderate Alzheimer's disease, so his memory is low. He is admitted to the hospital after a fall. He requires the surgery to repair a broken hip. Mr. Jenkins insists that he does not want surgery because he is 85-year-old. His son, who holds his power of attorney for the healthcare decisions, believes his father is no longer able to make the rational decision and agrees with the doctor that surgery is the best course of action. The ethical dilemma is, should Mr. ABC autonomy be respected despite his cognitive decline, or should the son's decision supported by the medical professions take precedence over? So, the solution is, while Mr. ABC's autonomy is important, his cognitive impairment must also be considered when evaluating his ability to make an informed decision. In this case, the healthcare team should assess his decision making capacity, and if determined that Mr. ABC lacks the ability to make an informed choice, the son's authority as the power of attorney should guide the decision with the aim of beneficence, avoiding harm to the patient. Coming to case number 12, a case of parental refusal of the treatment for a minor. The scenario is as such: an 8-year-old Neha is diagnosed with a highly treatable form of leukemia. The doctors recommend an aggressive course of chemotherapy with a high chance of success. However, Neha's parents refuse the treatment, citing their religious beliefs and the preference for natural remedies. So, the dilemma is such that should the medical team respect the patient's decision based on their beliefs, or should they intervene given that refusing treatment could lead in the death of Neha? A possible solution: this case highlights the tension between the parental authority and the child's right to life-saving care. The healthcare team should try to reach a consensus with the parents, providing information about the benefits of the treatment. If the parents need to refuse, the hospital may need to seek a court order to ensure that Neha receives the necessary medical care. After everything is exhausted, the doctors could approach the court for an order in such. Prioritizing her best interest, a good medical care which prioritizes the best interest while still respecting the family's beliefs as much as possible. This is a possible solution in this case. Coming to case number 13, advance directives versus the family's wishes. The scenario is as such: Mrs. Shah is a 68-year-old woman. She has an advance directive stating that she does not want to be kept on life support if her condition becomes terminal. If she becomes terminal, she does not want to be on life support. After a severe stroke, she is placed on a ventilator in the ICU. Her family is devastated by the situation, pleads with the doctors to keep her on life support, hoping for a recovery despite the poor prognosis. The ethical dilemma is, should the healthcare team follow Mr. Jameson's advanced directive or to consider the emotional pleas of her family? The solution possible in this case: the advanced directive should guide the decision making process. Mr. Jameson's clearly expressed wishes must be respected as they represent her autonomy. The healthcare team can provide emotional support to the family and help them understand the importance of respecting Mr. Jameson's end of the life preferences, which means that they can tell the relatives that the person needs respect, his decisions need to be respected. Case number 14, consent in public health emergencies. The scenario over here is that a contagious disease has broken out and Mr. Ajay, who is a 35-year-old man, is diagnosed with an infection. Despite being informed about its spread, he still refuses treatment and also refuses to be isolated. Now, he says that this is because of his personal autonomy is being restricted. His condition is worsening and there is a high risk of him spreading the disease to the others. The ethical dilemma is, how should the healthcare team balance Mr. Ajay's right to refuse treatment citing autonomy and with the need to public health should be safeguarded. So, in this case, a possible solution is that in situations which involve public health risks, individual autonomy can be limited to protect a larger community. The healthcare team should involve the public health authorities to enforce isolation and possibly provide treatment, even if it is against Mr. Ajay's will. This scenario emphasizes the ethical principle of justice, which in this case prioritizes the well-being of the public over individual autonomy. So, we have just discussed 14 cases which clearly emphasize the need for this ethical dilemma, and I hope that this is going to be useful for you to understand that how a doctor should behave or how a doctor should think when there are ethical dilemmas in front of him. Thank you very much.